And guess what? Today we have Dr. Renee Matthews, an asthma and allergy expert, joining us again. However, this time to discuss the impact of the smoke from the Canadian wildfire on human health, particularly within the Black community. We will delve into the potential health risk associated with the wildfires and learn when it's crucial to seek medical attention. Welcome to the show, Dr. Renee. Thanks for joining us here again on Fox Soul's Black Report.
Thank you for having me.
Please excuse that pesky little fly that wouldn't leave me alone. So, Dr. Renee, I've got to ask you to explain how the smoke from Canadian wildfires can affect human health, especially for folks in our community, in the Black community.
So, I don't have to say that unfortunately respiratory issues plague the Black community, specifically asthma. So the wildfire smoke contains fine particles and all sorts of toxic pollutants that once ingested and breathed, and if you breathe them in, they irritate the respiratory system. So that can cause coughing, wheezing, shortness of breath, chest pain, and of course exacerbations to asthma or anyone with a pre-existing respiratory condition. And then of course, we also often have heart problems. And so the fine particles in the wildfire can get into your bloodstream, causing inflammation, leading to increased risk of heart attacks and strokes. And anyone with any type of pre-existing heart condition, this is going to be especially difficult for you. Also, your eye, nose, and throat irritation. So the smoke from the fires can cause redness, itching, watery eyes, sore throat, congestion, and runny nose. Of course, this is going to aggravate anyone with a chronic condition, so that's asthma, COPD, which is chronic obstructive pulmonary disease, allergies. Those people are going to lead to more frequent exacerbations because of this. Unfortunately, of course, there's a mental health aspect as well, because people are being displaced, loss of homes, they're concerned about what the air quality, and of course, causing post-traumatic stress disorder, as well as depression and distress. And our vulnerable populations, we often always think about the seniors, but also this is also affecting children, as well as pregnant women and people who are immunocompromised already.
So, Dr. Renee, as the smoke drifts and impacts different regions, where is it headed next? And is it really that dangerous? I mean, it's smoke. Is it really that dangerous?
It is, because of the fine particles and the gases and the toxic pollutants that are in this air. That is why it is so dangerous. And unfortunately, it's headed to the Great Lakes. I know Detroit is probably going to see worse air quality today and tomorrow. And so yeah, that's the direction it's moving. The New Yorkers, actually, their air is starting to clear up. It's not looking, I said, that sepia color. It's not looking like that anymore in New York. So it is moving to the Great Lakes.
So, Dr. Renee, what are the common symptoms that individuals may experience due to exposure to wildfire smoke, and how can our soulmates differentiate between normal discomfort and symptoms that require medical attention?
So, nausea, chest pain or tightness, wheezing or whistling sound when you breathe, headaches, shortness of breath, coughing more than a light or a dry cough, and dizziness. So if you experience any of that and you have been outside or you've had your windows open, then you have probably taken in some of this air and you're starting to be affected, and you should definitely talk to your doctor.
And Dr. Renee, are there any unique health concerns or vulnerabilities that should be considered in relation to the wildfire smoke exposure?
Well, definitely the asthmatics as well as people with chronic obstructive pulmonary disease need to really be on alert, because we already have breathing trouble. So breathing in these particles that you can't see this stuff in the air, breathing in that is going to definitely exacerbate your condition. So you want to make sure that you are taking really good care of yourself and taking all your medications, making sure that you've refilled all your prescriptions. There's been horrible drug shortages this year, and so the medication shortages were already bad. So you can imagine now that this is going from the East Coast to the Midwest. Mm-hmm. It's quite a pull on the pharmaceuticals to get these meds out.
I know I have a number of asthmatics in my family. I'm sure a lot of our soulmates are also asthmatics. As an asthma and allergy expert, what specific advice or recommendations do you have for folks with asthma or allergies, or who may be particularly vulnerable to the effects of the wildfire smoke, and And in order to effectively manage their conditions and mitigate any kind of potential exacerbations during this time, what advice do you have for them?
Carry your rescue inhaler. Do not leave home without it. And also, of course, if you have to be outside, definitely make sure you wear a mask. And like I said before, please make sure that you have all of your medications, because you need to make sure that you have taken all your medications. Most of us are on preventative medicine, so you want to make sure that you're keeping up with that, so that you, just in case you do take something in, hopefully you've had enough medication that it'll treat that.
And Dr. Renee, are there any preventative measures or actions that our soulmates can take to minimize the health risk associated with the smoke? We're worried about our soulmates. And so
Yes.
the smoke from the wildfires, what's your advice to our soulmates?
If you can stay indoors, I know that is not possible for many of us. We have to get to work. So if you are going to go outside, wear an N95 or a KN95 mask when you go outside. Use HEPA filters in your house if you can. HEPA filters are high efficiency particulate air filters, and they'll remove a lot of those fine particles from the smoke. Also, turn your air conditioner on, but put it on the recirculate mode. So even if you're in your car, that's got that little elliptical kind of a circle thing, put it on the recirculate mode so you're not bringing the air any outside air into your car. And avoid physical activity outdoors. Any activity where you're going to be heavy breathing, if you're running or exercising outdoors, you're going to take in more of that air. So you want to, stay away from doing that.
All great information. And where can our soulmates check the local air quality until the ghost is clear? Where can we go to figure that out?
So there's an amazing website, airgov.now, and it is from the EPA. And you just put in your zip code, and it'll tell you the air quality for where you're located, and it will also tell you who should be on alert. Like it is already stated that City of Detroit, people like myself with asthma need to be on alert today and tomorrow. So it's a really great website, and they're keeping it up to date.
Our thanks to Dr. Renee Matthews for joining us here again on Fox Soul's Black Report. You are saving a lot of lives and preventing a whole lot of discomfort while we figure out how to get back to better air quality. Thank you, Dr. Renee.
You're welcome. Thanks for having me.